Hi, my name is Sarah Brown, and I'm a voice specialized speech pathologist. I'm also a singer and a singing teacher, and I'm here today to give you tips about vocal health. These are the things that I wish I knew when I was a student studying opera as a part of a voice performance degree. A laryngologist and an ENT physician are not the same thing. So, an ENT doctor is a general ear, nose, throat physician who has special training in ear, nose, and throat. However, a laryngologist is an ENT who has gone on to do fellowship training in laryngology specifically. That means they specialize in voice. Their equipment is fancier, their ability to diagnose is going to be more accurate, and their experience surgically is going to be more advanced than a general ENT. So if you need a vocal cord check, would definitely recommend seeing a laryngologist if possible. Also, ideally, they'd be working with a speech pathologist who specializes in voice. That way you know you're getting behavioral, medical, and surgical. On top of that, if you're getting any kind of head and neck surgery done, whether that's having your tonsils out or having thyroid surgery done, for example, definitely consult with a laryngologist because they'll be able to give you advice on how to minimize the risk to your voice. Tip 2. It is healthy to sing in other styles other than just opera or just classical. It actually can help your classical technique to be cross-trained in other styles. Now, this is not a license to just go scream your head off. Obviously, strained voice use is strained voice use, but it is healthy to sing in more than just a classical style. Belting can be done safely. I also think it's extremely important for women to train their chest voices. Tip 3, you should be doing some kind of SOVT exercise daily to warm up and to cool down your voice. Now, SOVT stands for semi-occluded vocal tract, so that's anything that partially obstructs the front of your mouth. That could be Z, V, straw phonation, trills, any of those are fair game. They help to maintain your vocal fold health, and they help to balance your airflow with your voice, with your resonance, which can make them great to smooth over any tricky spots in your range. Tip 4, your speaking voice health is just as important as your singing voice health. And it's not that we need to talk like opera singers all the time, that's not what I'm saying, but your voice should generally feel like it has a forward resonance and should be supported by breath. We don't need to have our speaking voice stuck in the back of our throat. Tip 5, there's actually manual work that can be done to release tension in the larynx, jaw, and tongue. And by this I mean physical massages, physical stretching of these structures. I think it's really important for any vocal athlete to know how to do this. Tip 6, some vocal myths. Coffee is not necessarily dehydrating to the vocal fold, so unless it triggers you personally for reflux symptoms, not necessarily a problem. Also, dairy, that's going to be on an individual basis. Not everyone is sensitive to dairy, so if you're not sensitive to it, feel free to have some before you sing. Last tip, and I feel so dumb saying this, but I think when I was a student, I didn't really believe the importance of hydration for vocal function. So yes, actually drink 2 to 4 liters of water a day. You should be peeing pale. Also, good sleep. Good sleep goes a long ways.